For literally centuries, the way we see a doctor, it just hasn't changed. But in just the last couple of years, that entire foundation has been totally flipped on its head by this huge digital shift. So today, we're going to dive into the rise of telemedicine and see how it's changing, well, pretty much everything about healthcare.
Okay, so let me ask you something. Think about your last doctor's appointment. Was it the usual deal? Driving to the clinic, sitting in that waiting room, flipping through old magazines? Or was it totally different? Maybe a consultation through your phone or your laptop. That experience right there, that's what we're all about in this explainer.
All right, so here's our game plan. We're going to start with the old way of doing things, then talk about the pandemic, the big catalyst. After that, we'll look at the virtual doctor's office today, the new challenges that come with it, and finally, what the future might hold. Let's get into it.
Okay, first up, the old paradigm. To really get what's changed, we've got to understand what it was like before. And for generations, a very long time, there was basically just one way to get medical care.
For hundreds of years, medicine had this one simple, non-negotiable rule. You had to be physically in the room with a doctor. That's it. The whole doctor-patient relationship, whether it was for a quick checkup or something really serious, it all came down to being there in person. That was the only model anyone knew.
So if that model was set in stone for centuries, what on earth could possibly change it? Well, as we're about to see, it took something massive, a global pandemic. That was the catalyst that forced this huge, sudden jump into the digital age.
And this timeline, wow, it just shows you how fast this all happened. For decades, remote care was just this idea, right? Kind of floating around, but it never really took off. And then, bam, early 2020 hits. Suddenly, virtual visits weren't a nice to have, they were the only option for a lot of people. It wasn't just growth after that, it was a full-on explosion. Digital health platforms just popped up everywhere at a speed nobody saw coming.
Which, of course, brings us to right now. Section 3, the virtual doctor's office. This is a whole new world of access.
Yeah, this comparison really nails the difference, doesn't it? The old way, that was all about the physical journey, the travel, the time off work, the cost. The new way, that journey is now just a stream of data. It's about getting connected instantly, and it doesn't matter where you are. The expert comes to you.
And this is where it gets really powerful. Think about people in remote areas. This quote just says it all. Now, geography does not matter as much. A patient in a remote village can consult with a top neurologist in a metropolis. Just let that sink in. That one change is a massive, massive step forward for making healthcare fair for everyone.
It's such a powerful concept, isn't it? A diagnosis, a check-in, it can all happen over a video call. And look, this isn't just about making things easier. This is about completely rethinking how we deliver care. It's about finally bridging that huge gap between the people who can get great care and the people who can't.
But, of course, it's not all sunshine and roses. This incredibly fast change hasn't been perfect. And that brings us to our next section. With all this new access, we've also got a whole new set of problems to solve.
So the challenges really boil down to a couple of big things. First, there's the tech itself. A frozen video call is annoying when you're talking to a friend, but with your doctor, that's a real problem. Not to mention the huge issue of keeping all your private health data safe. Then there's the human side. What about people without good internet? We can't just leave them behind. And you gotta wonder, what do we lose when that personal human touch of a doctor's visit gets replaced by a screen?
Which leads us to the million-dollar question, really. For everyone, patients, doctors, tech companies, how do we find that sweet spot? How do we get all the amazing convenience of telemedicine without sacrificing security or the quality of the care we receive?
And figuring that out, well, that's what our final section is all about. We're looking at an evolving future where the name of the game is going to be adaptation. And here's the bottom line for what comes next. Telemedicine can't just stay the way it is right now. If this is going to be a real, permanent part of how we get healthcare, it has to keep changing, keep getting better.
So what does that actually mean? Well, first, the rules have to catch up. A lot of our laws were written way before any of this was possible. Second, we have to help people get comfortable with the tech, especially older folks, so it's a tool for everyone, not another hurdle. And third, and this is the real game changer, wearable tech. Imagine your smartwatch sending real-time health data directly to your doctor. We're talking about moving from just treating sickness to actively keeping people healthy.
Now look, this isn't going to happen overnight. There are still a lot of challenges to work through, but you can't deny the momentum. The direction we're headed in is crystal clear. Those old, in-person-only models are on their way out, and a new, much more accessible era is just getting started.
And that leaves us with one last, really important question to think about. We know technology is tearing down these old walls, like where you live. But as we're building this brand new system, what new walls do we need to be careful we don't accidentally build? Walls made of technology or access or privacy?